Post-exposure prophylaxis, PEP, in HIV/AIDS is the use of antiretroviral medication to prevent HIV transmission after a potential exposure. PEP is typically initiated within 72 hours of the exposure and lasts for 28 days. In this article, we will discuss all the details of PEP and HIV/AIDS under relevant headings. 1. What is PEP and HIV/AIDS? Post-exposure prophylaxis, PEP, is a type of treatment that is used to prevent HIV after a potential exposure. PEP is a combination of antiretroviral drugs that are used to prevent the HIV virus from multiplying once it has entered the body. PEP is typically initiated within 72 hours of the exposure and lasts for 28 days. The aim of PEP is to reduce the risk of HIV transmission. 2. How does PEP and HIV/AIDS work? PEP works by using a combination of antiretroviral drugs to prevent the HIV virus from replicating within the body. The drugs used in PEP stop the virus from entering the cells and multiplying, which reduces the risk of transmission. PEP typically consists of a combination of 3 antiretroviral drugs that are taken for 28 days. 3. Who is eligible for PEP and HIV/AIDS? PEP is typically given to individuals who have had a potential exposure to HIV. This may include healthcare workers who have been exposed to HIV-positive blood or other bodily fluids, individuals who have had unprotected sex with an HIV-positive partner, or individuals who have shared needles with someone who is HIV-positive. PEP is only recommended for individuals who have had a potential exposure to HIV within the last 72 hours. 4. When should PEP in HIV/AIDS be administered? PEP should be started as soon as possible after a potential exposure to HIV. Ideally, PEP should be initiated within 2 hours of the exposure. The longer the time between the exposure and the initiation of PEP, the less effective it will be in preventing HIV transmission. PEP should be started within 72 hours of the exposure at the latest. 5. What are the side effects of PEP and HIV/AIDS? PEP can cause side effects in some individuals. The most common side effects of PEP include nausea, vomiting, diarrhea, headache, and fatigue. These side effects are usually mild and go away on their own within a few days. In some cases, PEP can cause more serious side effects, such as liver damage or an allergic reaction. 6. What is the success rate of PEP and HIV/AIDS? The success rate of PEP in preventing HIV transmission depends on how soon it is initiated after the potential exposure and whether it is taken correctly. When PEP is started within 2 hours of the exposure, it has been shown to be highly effective in preventing HIV transmission. However, the effectiveness of PEP decreases the longer the time between the exposure and the initiation of PEP. 7. How is PEP and HIV/AIDS accessed? PEP is typically accessed through a healthcare provider. Individuals who have had a potential exposure to HIV should seek medical attention as soon as possible and discuss the possibility of PEP with their healthcare provider. PEP is typically available at emergency rooms, urgent care clinics, and HIV/AIDS treatment centers. Conclusion. PEP in HIV/AIDS is a treatment that is used to prevent HIV transmission after a potential exposure. PEP should be initiated as soon as possible after the exposure and lasts for 28 days. PEP is typically only recommended for individuals who have had a potential exposure to HIV within the last 72 hours. The success rate of PEP in preventing HIV transmission depends on how soon it is initiated after the potential exposure and whether it is taken correctly. PEP is accessible through healthcare providers and should be sought out as soon as possible after a potential exposure to HIV.